Welcome everyone to session 6, Greening Primary Health as part of the solution. How can we help transition to a sustainable health sector to care for children today and protect future generations? So thanks to our sponsors for their contribution towards our conference. Remember to pop over to the sponsors lounge and browse through the individual pages. Please take note of the health pathways for this session on screen at the moment. And if you have a question for Dr. Forrester or Dr. Huang, please type your question into the live Q&A box or raise your hand during the question time for those in the room. So we will ask as many questions as we have time for at the end of the presentation, and I think the presenters would like to have a bit of a discussion for this one. So I'd now like to welcome Dr. Forrester. Other Dr. Forrester. Mike is a general paediatrician and senior clinical lecturer at the University Hospital Geelong. He's a senior research fellow and clinical lead of the Sustainable Healthcare Network and an associate Institute for Health Transformation Deakin. So that's the SHN and IHT. They deliver high-impact health sector decarbonisation research to inform this vital transformation. So Mike is also the Victorian Chair for Doctors for the Environment Australia and a member of the National Sustainable, what's the rest of that sentence? Healthcare Special Interest Group. Great. Now also Dr. Jenny Huang. Jenny Huang trained as a GP in the UK and moved to Australia in 2019 during the Black Summer fires. She's been an advocate for health literacy and planetary health, the foundations that our communities need to empower themselves towards healthier, health-seeking behaviours and alleviation of the pressures that our health systems face. She continues to work in Australia in her active roles in the RACGP specific interest group in climate and environmental medicine and Doctors for the Environment Australia as well as Healthy Futures. She feels honoured to work with like-minded colleagues at the Banksia Medical Centre, caring for the Geelong community and whom she's discovered are very much in support of building a sustainable, healthy future together. So over to you guys. Thanks. Go on.
Hello, I'm Georgina. Today you will hear my mummy and Dr. Michael Forrester, who is a doctor looking after little but important people like me and my brother, talk about how you can help transition to a sustainable health sector to care for children today and protect future generations.
The green button or? So I'd just like to acknowledge the traditional custodians of the land and sea in which we work and live, and we recognise their continuing connection to the land, sea and culture. We pay our respects to the elders past, present, and from who we have so much to learn from. So today we're here to help you recognise that climate change is actually the biggest health opportunity of the century and that we have a significant role to play. We'll be introducing key concepts for about 25 minutes to facilitate 15 minutes discussion and regarding sustainable practice opportunities at levels of system, practice and consultation. So these images you probably would have seen online floating around, but when I first started working in Geelong, I've actually had plenty of Deakin students wearing shirts that says there's no planet B, which then helped support or encourage me to start talking with them about what they feel passionate about and allowed me to feel comfortable about it. And then obviously my kids and their school, I hear a lot, well, if not us, then who? And if not now, then when? So in December 2019, the RACGP declared climate change as a health emergency, following reviews of substantive and compelling body of medical and scientific evidence. It acknowledged the serious threats posed to the health of children, the older Australians, and those in rural and remote communities. The effects of climate change disproportionately affects the health of Australians with asthma, respiratory conditions, and heart disease. More deaths from heat waves can be expected, with young generations increasingly likely to have mental health effects. We've heard a lot about all of that through this weekend. Health impacts in Australia are also likely to include more deaths from the spread of infectious diseases, such as malaria and dengue. Health burdens from post-viral syndromes such as glandular fever, Ross River virus, Barn virus, and these days, long COVID.
Diarrheal illnesses are also expected to grow. The college has developed resources recognising the emergencies that will increase with climate change topics, including bushfires, thunderstorm and asthma, extreme weather events, and mental health and emergencies. The RSCGP board has taken a significant step in its environment, social and governance policy, formulating a coordinated approach to monitor, review and develop progress in addressing environmental issues. One of the recommendations is to provide educational opportunities for GPs to learn about it, communicate about it and research it. Over to Mike.
Thanks, Jenny and kids, and thanks to you all for choosing this session. Thanks to the PHN for inviting this. So, because you chose this session, it means you probably get it. And I know there are a few champions in the room already. I see Dr. Joe, he with his wife Kitty are already trying to transform the borough of Queenscliff. I know Bernard's about to transform his practice, and I'm sure many of you are already acting in this space in some way. So I thought it might be useful to just start with a quick update regarding the background against which we in the health sector are trying to respond, with a couple of slides that you might need to summon your inner Om, do a few yoga breaths, but then we'll get through that and talk about action and hope. So, and remember that hope is just optimism with a broken heart. So we've got to, so let's go to the AR6 IPCC key messages, couple of important slides. This one looks at the, on the left you can see the range of trajectories, and we do still have a range of trajectories, but this decade is really the turning point where we essentially choose our trajectory. So we're currently on the intermediate to high emissions trajectory, which means if you ask most IPCC scientists offline, they think we're headed at around 3.5 plus degrees of warming this century. So the second on the right, then you can see that graphic is really looking at, in the interval between AR5 2014 versus AR6 last year, how have the predictions changed? And essentially, the more purple the bar graph gets, the higher the mean temperature and the greater the risk of breaching multiple planetary boundaries. So things have unfortunately got worse in that intervening period. And that's because this has been this has sort of represented the key policy responses between those two reports. Yes, everyone's got a 2050 target, that's very hip, but actually it's largely business as usual, and that's what we really need to try and use our voice and our leadership to change. So if we look at another way, here's how climate risk is looking for generations who are born now. It was definitely much cooler to be born in the 50s, and we're now looking at significant sort of emission scenarios. So you can see on the right the range of emission scenarios from very low to very high, and what that would mean. So if you're talking about, say, a 3.5, 4 degree temperature rise by later this century, well, that's 10 times more days of the temperature being 45 degrees. So much higher risk of heat stress and fires and everything else. So understandably, young people are increasingly concerned about this. There's unequivocally a significant rise in climate anxiety. Is it reasonable to call it anxiety, which sounds like a pathology, when it's actually probably just a very reasonable response to the situation they're facing? But certainly it's something people are going to say, young people are going to be making their number one voting concern. And this is the range of things that young people are now saying they're concerned about. And you're talking about, the vast majority of young people now are concerned about this, and we've got to respond to that. So the IPCC raises 10 key solutions here. The obvious being to retire coal plants and to decrease fossil fuel extraction. And investing in renewable energy, number 2. Now that may appear obvious, but we do still have a rhetoric around, gas-powered transition. We need to call that out as just rubbish, unfortunately. We actually now know that for example, the Beetaloo Basin, which is, we've got a bunch of paediatricians have just written to the relevant ministers in the Northern Territory to say how concerned they are about the health implications of that in the long term. That site alone would do something like 20 times increase Northern Territory's emissions. It would be responsible for about 20% of Australia's current emissions. That's one site. The Northwest Shelf in Northwest Australia would be something like equivalent to all of Australia's domestic emissions until 2050, and that's one project alone. So we've just got to keep that in mind. And investing in clean energy also starts at home. So just think about, where your own investments are. I was there campaigning against fracking a few years ago and realised at the same time I was actually investing in fracking with my default superannuation that I had through the hospital. Most of us are, until you look. And it's not that hard actually to talk to your advisor about shifting to socially responsible investing. It ends up about the same, I'm told, as investing in fossil fuels and nuclear arms and slavery and things like most of us do. And actually, just out of interest, if you want to only invest in those things, just in slavery, nuclear arms, gambling, etc., you can too. And that also forms about the same. So, actually, and I might go back to that last slide because so most of these things are actually relevant to the sort of transformation that we need to take on ourselves in health and also advocate for. Retrofitting and decarbonising buildings, think about how we use cement, steel and plastics, shifting to EVs obviously, public transport, becoming an infrequent flyer, that's going to become hip hopefully, try to decrease deforestation, planetarian diet, reducing food waste, and we'll get into what's specifically relevant to us shortly. So, I guess the question is, you might be sitting there saying, well, I'm already doing so much. We've just dealt with the pandemic. I'm exhausted. Our system sucks. Now I have to do this too. And yep, I hear you. Yes, we do, unfortunately, because this is the most important public health issue of the century. And so, just think about what part you can play. And we can all play different parts based on what your skill set is and what your energy is. But they would argue that health professionals have worked hard to protect against health threats such as tobacco, HIV/AIDS, polio, and now we are dealing with a very significant challenge, but also huge opportunity. And we are a trusted voice on the Veracity Index. Nurses just pipped doctors at the post there. Surprisingly, politicians were down the bottom. How'd that happen? And so just we're a trusted voice and we can use it. So let's just talk a bit about the health issues. Probably just worth understanding the way these are being conceptualised is generally with regards to direct impacts, such as extreme weather events and, so heat stroke, bushfires, smoke, etc. And then indirect impacts via the exposure pathways, air quality, impacts on asthma, etc., water quality and the diarrheal illnesses, etc., food supply and safety, vector distribution and ecology. You'll have seen that some of the infections are crossing latitudes. I had the great pleasure of getting Ross River in Geelong not so long ago. And then social factors, so just displacement. And we're looking at some of the forecasts are between 1 and 2 billion climate refugees by 2050. So just think about what the world looks like in that situation. That's if we continue on the current trajectory. So let's flip that around and think about, so what are the advantages of switching the situation while we can? So there are a huge range of health co-benefits to trying to shift the course of what's happening with the planet. And so along the bottom you see a range of health benefits from mental health to cardiovascular, respiratory, etc. And on the left you see the range of interventions. So for example, promoting public transport on the left leads to increased personal cardiovascular health, breathing clear air while you're riding to work, and decreases the carbon footprint of that transportation. So, and then, look, I guess this is the downside of taking action, I suppose. It's a good way to think about it. So, let's think about the health sector. So, once you start getting into this, you have to understand engineering language. I'll just give you a very quick tour of this. Scopes 1, 2 and 3. Scope 1 is all of the energy consumed on site. So at Barwon Health, half of our power comes from gas trigeneration, which was a good idea actually. A couple of decades ago you would use gas to make electricity, and the heat that was generated on the side heated the building and the water. But now we know that we can do much better with renewably powered electrical heat exchange infrastructure. So we need to decommission our gas cogen, and we need to also think about other gases used on site, and that includes anaesthetic gases, so nitrous oxide. So nitrous actually is a really potent greenhouse gas, and we don't really necessarily need to dramatically decrease how much we're using nitrous, say, to women giving birth. You know, they probably use about 90+% in the hospital. There might not be a great alternative to that. Sometimes there will be, but actually we can deal with the leakage from the pipes before it gets to that woman. So we're leaking about 1 million litres a year at Barwon Health. We've just been crunching the numbers on that. That's equivalent to about that's about 2.5 million kilometres of driving equivalent, or taking 250 cars off the road for a year if we can just deal with the leaks. So if we can do that at a national level, that's a significant impact. In terms of scope 2, that's the electricity you buy. So we need to shift to buying renewable power for the hospitals. That's going to happen statewide under VREC 2. We'll have 100% renewable electricity to all public buildings by 2025, and we can do the same in our practices and in our homes. That's an easy switch to make. Scope 3 is everything else. That's probably about 70% of our footprint. That's what it takes in terms of the all of those factors you can see there: production of purchased materials and waste and food waste and employee and staff travel, etc., etc. There's lots of ways we can look at that, and we've got a project looking at that at Barwon Health as well. So the health footprint's significant. It's about 7% of the national footprint. It's about equivalent to the health footprint of South Australia. Globally, the health sector would be equivalent to the 5th biggest country in the world in terms of health footprint. So it's worth us all plugging away at this. The NHS has a plan to become carbon neutral by 2040 across all of those scopes, which is an amazing, audacious plan, and they are on target to do it, and the rest of us are just trying to scurry and catch up. And that's including the primary health sector and the NHS, because there's an integrated system there, as you know. For all of its failings, it's got some advantages. So where does general practice fit in? You can see there in the red 4%. So good news is you're only responsible for 4% of the 7%. Unless you think about health system factors and the sort of thing that Erasmus was talking about in the project that Bianca was alluding to, where you can think about how might you reduce low value and unnecessary care. Because if low value care is 30% on the right of the care we currently provide, or the interventions we currently provide, just think about what's the cost of doing unnecessary MRI for back pain, or unnecessary blood tests, etc., etc. And 10% potentially harmful. So if you could erode into that 40% of burdensome or unnecessary interventions, well, that's a significant move towards decarbonisation at a system level. And the fabulous Deb Harley is featured here, working with Choosing Wisely Australia, and that was a project where they looked at, just asking these 5 questions for any intervention. I'm sure she could talk to you more about that. So let's go back to Jenny and start talking about what about at a practice level.
Jenny, 5 minutes.
Right, so I'm just going to give you some ideas of how we can act at the practice level. Just to start off with, the colleges, so Australia, New Zealand and the British, have actually drawn up toolkits and guides for us all to get started. Just start small and just try things out. And these are posters. I put some on the tables. You can have a look, but easy to download, laminate and put up around your practice. And with the slide you'll get later, would be great for the RICGP Climate and Environmental SIG Group have been working with the board to explore how to support practice owners in transitioning. So you can use the QR code later. So just quickly overall, non-clinical emissions may be something that's easier to make a start on. As you can see, 1/3 are seen to be addressed by encouraging and supporting staff and patient travel with providing bike racks or small charging stations for scooters or EVs. Also thinking about how electricity is sourced and used. Now this is an example from a North East Victoria GP practice where they sterilised and reused instruments in paper bags as well, setting up solar and purchasing renewable electricity, better insulation, ensuring that your heating and air cons are energy efficient, setting appliances in eco mode, LED lights, have waste streams put up, and separating compost waste, giving them to the staff with chickens, have a TerraCycle drop-off point for soft plastics and even PPE gear, and also stationery. So I've just got some photos to show you. So that's the solar panels that they put up, and then the waste disposal guide in the staff room, and the waste stream in the consulting room, and the TerraCycle, like the coffee capsules. And that's stationery, tapes, cellulose made instead of plastic, because once you've put those plastic tapes on, you can't really recycle anything. And yeah, supporting with paper, that's sort of supporting the First Nations. And this is actually George in Perth, outside his practice. And the benefits is to the community, our patients, opportunity to share knowledge with one another, sense of reward and fulfillment. It's an opportunity for physical activity, and then nurtures self-confidence, achieving goals and enjoying the food that you've grown. It also fosters self-help, nutritional health. It's also providing an environment that promotes social inclusion and interaction for people with disability, frail older people, and this intergenerational connection that we've lost. So really goes towards lessening the risk of mental health effects from the isolation and disconnect that we've been hearing about this weekend, improving health literacy. And within the consultation, we can apply our knowledge too. So we as GPs, as Kim Edgar yesterday described so wonderfully, are woven into the fabric of our society, and we are their family practitioners and a trusted source of health guidance. So within the consultation room, well, I'm not sure where that's, oh, okay. So social prescribing, you can just see up there, but mainly I brought that up is because, again, it really enforces learning new skills and increase employability, practice social skills, building supportive social networks, structuring time, increasing self-esteem, empowering people. It just really helps with lessening the learned helplessness that we're seeing these days. And practicing high-value care, which Michael had already talked about, so reducing unnecessary tests and imaging, it all adds up. And de-prescribing, choosing wisely, as well as the handbooks you can see on the other side are some resources to help with that. And care plans, so integrating like what to do during heat waves for those with cardiovascular disease or diabetes, and thinking about air quality index and the pollens changes with the change with, the climate change and humidity. Into the care plans as well for those with respiratory conditions, and disaster action plans. So hopefully with what we've brought to you today will allow you to feel a bit more open to help young patients to express their anxiety regarding the future. Kids Helpline, they have counsellors as well as practical strategies for children and young people to reach out to. Over to Mike.
So really just a couple more ideas now to discuss, and then we'll throw it open to discussion. So this is just one example from Scope 3, looking at pharmaceuticals. The propellants in metered dose inhalers are actually significant greenhouse gas agents. So we shifted from chlorofluorocarbons, that was really good for the ozone layer, but we've got hydrofluorocarbons still, which are very potent. So one puffer is worth 200 and, what is that in kilometres? 230 or something. Kilometres of driving, whereas you could have the same amount of medicine in a dry powder inhaler, and that's much less, say 6 or so kilometres. So there's potential to think about using a co-benefit framework. The Salford study in the UK, published in Thorax, looked at 1,000 patients randomised in each group to shifting to dry powder inhalers for their preventer versus propellant, found significantly improved asthma scores, and found that they halved their carbon footprint. That's the sort of work that's being undertaken, and sort of guidelines will start emerging on this, but it's the sort of thing to start looking at. If you're interested in this space, the Breathe Green project in the UK has a range of resources for patients, GPs, etc. on what we do know so far. Lots of work to do there still. And then this was just, again, why we are being called on to act in this space. And let's just go on then to the points for discussion. So if we agree that climate change is a health issue and a huge opportunity to change our future, how might we contribute as policy advocates, as leaders in decarbonising our health sector, and as educators and supports for our patient? And amidst all that, how do we look after each other? So I throw that open to the room.
All right, great. And also a few other details if you want to get on and find out about the DEA conference. And also, of course, Doctors for the Environment Australia, you can join. And there's a bit more on global green and healthy hospitals. All right, so, I mean, Mike called for ideas. I'm also going to call for questions. Is there anyone in the room that would like to raise an idea or a question? Yeah, come on, back here.
Thank you. I suppose one thing that comes to mind is just with the inhalers there, with the being told to advocate use of a spacer. Yep. So with the dry powder, is that going to be an issue in that situation, especially in emergencies?
Yeah, so probably 2 points there. One is there's potentially a good co-benefit argument there. So when kids are old enough to transition to dry powder inhalers, then for exercise-induced asthma at school, I'll often ask them, would it be helpful for you to have to shift instead to a dry powder short-acting beta agonist that they can use a couple of puffs before sport rather than not using their spacer at school because they never have their spacer in their pocket at lunchtime. So actually, that's a good co-benefit argument that they'll get better exercise-induced asthma relief from the dry powder inhaler and they don't need a spacer. There'll be a different challenge in the ED, and so that's something that we really have to think about. And it might be that you don't try to completely transition away from propellants if that's what is required in ED, but there's a lot of room to move. And also there's a lot of work to be done on making sure the propellants we do use have a much lower global warming potential. So there are some on the market that now have maybe half the global warming potential. We don't have them yet here in Australia, but they are available globally, and we need to advocate for that, and we need to come up with zero GWP propellants, and there are a couple of good ideas floating out there. We have to stick with what's best for the patient, but there may be opportunities to be able to shift to what's good for the patient and the planet.
Joe? I think Joe. Oh. And we'll come to Justin.
Just a question. Do you think in the future with accreditation and things that this could be part of that for practices as well?
Of practice accreditation?
Yeah, so practice accreditation.
Yeah, so you'll see the survey that I had earlier, so that's part of that work. The RSAGP has been trying to get an audit tool together that will, and Leah Penny is also looking into that. She's our PHN Sustainability Officer. So it's just be more standardized across so that things can be measured so we can actually look at outcomes and then improve further on. So yes, it's coming.
Does everyone already know about Leah, actually?
No, I was going to say, do you want to introduce Leah?
Yeah. Well, yeah, Leah Penny. So would you like to just, would you like to stand up and just...
Sorry, the microphone's...
Oh, sorry.
Do you mind just on Leah's behalf? We can come back, actually. Actually, why don't we ask this question and then we'll come back to you, Leah. Yep.
Okay.
Just a quick question for you, Jenny. Being a mum and in the field, so to speak, what do you think about our kids reminding us as parents, or in your practice, having, information or something to empower the children to remind the parents of what they need to be doing?
Thank you. That is a good question. I think I actually started to learn more about the climate crisis that we're in after giving birth to my eldest. And it's actually with their school, and 1 in 4 young people apparently surveyed last year of 18,800 people are actually very worried. I'm extremely concerned. So I think for them, seeing what I do and knowing about my talk, I guess as role models, they're seeing me act, and for me myself as well, it lessens my own anxiety, I guess, about what I might, what they might face.
And we also get to share the wins with them, share with our kids that we've just ended logging of native forests in Victoria. That's a win. Share the significant adjustment in renewable energy targets that we've got at a state level. That sort of thing, we try and share all that as well.
I think even just day-to-day things, they see that I don't actually end up with a lot of waste, and they like that. My son, for some reason, always wants me to pick up rubbish on the road. That was like that from the start. I don't know why, but so that gets us into good habits. So. Oh, Lee?
Come on through.
Yeah.
Just before we introduce you, I was just going to say, get questions in online, guys. So for those of you at home, we've got another 10 minutes, so we're going to spend quite a bit of time in discussion. So do bring those questions forward, or any of those ideas. I mean, I think that the asthma puffer one represents one of those kind of easy, quick wins that might get people motivated, and we're looking for some of those things to get people started, and then there's a lot more we can do. Thanks. Sorry, Leah. Thanks.
No, that's all right. No, for people who didn't know that I was around, so the PHN have made a real commitment, and it will be certainly part of our values now to support and integrate, our learnings that we're going to be going through in the next sort of short amount of time over the next 3 months. And we're putting together a fit for purpose program that will then we'll reach out to our members and our GPs and where applicable, support you in our journey and help you, put initiatives in place that we've already got some evidence around, and draw on some best practice across the world. And so for anyone who is interested, please put in the feedback. So there might be some initial people that have already put a plan in place and need some support, and I'm available here for you, going forward to help you in that area of business.
That's great.
Thank you.
I'd just like to add one more thing, that the key message I would like to put across is that what is actually good for us is actually good for the planet. We had MP campaigns last year, and one of the MPs asked, now we've got to add in a consultation, but really encouraging patients to exercise, encouraging patients to stop smoking, and all of that actually contributes towards lessening emissions and actually better for their mental health as well, better for their physical health. So what is actually we've been doing with preventative health is actually really, really important too, to look after our own world and environment that supports us, which we've seen so well. I think the pandemic really demonstrated all of that, how the disconnect with the children from not being able to see each other. Providing a space, the garden, for example, really can help them to learn and connect up with, the older generations again, and get them away from the screens, for example, too. Sorry.
Okay, so we've got a question from online. Are there any posters or links for doctors and patients to talk about changing from MDI to powder medications?
Thanks for that question. Look, it's still early days. I think we still need to really evolve the guidelines in that. Have a look at the Breathe Easy project. That has actually got quite a lot of good patient resources. But in Australia, we haven't quite got the guidelines yet in the Australian format. I've just been talking to Asthma Australia about this. They're very interested in this. When they've asked their consumer base what they want, the number one thing they want is actually action on climate change, and particularly on air quality. So there is a move for this at the consumer end as well as at the health sector end, but it's in evolution. One interesting thing I should say, if you did find a patient where you and the patient agreed that switching to a dry powder inhaler was going to be the best management step for them, if they were someone who was using one device a month, the planetary impact of that would be the same as one of you becoming vegetarian. So that's if you've got the pressure about, should I have that bit of meat? This is something you could do as an alternative.
Any other comments or questions from the floor? And sometimes actually even name and faming someone that you see that's doing good things in regards to greening primary care. That could be something to share.
I think just on that idea of global green and healthy hospitals, I think that's really interesting because out in the community in Melbourne where I work as a community nurse, like we looked at, we have a sustainability and climate group that looks at all these, things we do at like the GP and community health level, like as to, in terms of like even looking at our outreach kilometers that we clock, every week to reach out to clients.
Has your team organised an audit or organised a project plan?
There is a team that looks at that sustainability side of things. So
yeah, that's fantastic. So the GTHH conference is the umbrella organisation is the Climate and Health Alliance, which is for anyone in the health sector to join. Nurses, allied health, doctors, everyone. Fantastic, really powerful organisation doing great work. At last year's GTH, they presented on Ambulance Victoria had shifted to doing a lot of phone-based triage, looked at how significantly they could reduce the need for vehicles with drivers to go out to the site just by being able to talk to the person and potentially redirect. And then they calculated the number of trips to the moon they saved their ambulances in 1 year. It was quite amazing. Okay. More
I've got a couple of
Yep.
online questions
Yep.
here. Are there any additional supports in place to help fund GP practices to set up solar power on their roofs and electric car charge stations, for example?
One thing I do know is that there was supposed to be $50,000 available during the pandemic to help GPs respond to that, and that money came late, as it always did. But there may be things that you can use that money for that could be useful. I don't know about the solar panels, but Bernard would probably know how that money might be spendable in things that have co-benefits. Separate discussion. That's probably a by Bernard lunch discussion.
I don't know, Leah's got some ideas, but Bernard, why don't we hear from Leah, and then if you have anything you'd like to add, if people are looking to spend the $50,000, it'd be nice to have a bit of a shopping list.
I only just want to say that I'll be setting up, and Bernard's going to be helping me do this. We're going to do obviously a baseline and a study around the return on investment. And I think from what I'm seeing, across the world, is that the return on investment's going to be, clearly outweigh what your initial outlet's going to be, and it would probably be paid for within, a 2 to 3 year program. But within even Geelong, there is some elements of projects that will feed into that, and perhaps, do 0% loans while you pay off that initial loan, and the rest will be return on investment for practices. So there's certainly things out there, and just reach out and I'll help you find them.
Yeah, that's a really good point. So we went solar on our practice and it's paid for itself within a couple of years because we're only using the power by day anyway in the practice. Just while we're waiting for other questions, I thought I might just flag this little advocacy piece that is of interest. So this is looking to move all new buildings away, all new domestic buildings away from gas plumbing. They've already actioned this in ACT. All new domestic builds need to be all electric. Many medical groups are getting behind this because of again, a co-benefit argument that it's from a planetary point of view, it's much better to run your homes and practices as all electric, but it also will significantly decrease the childhood asthma risk. So indoor gas cooking estimated to be responsible for up to 12% of childhood asthma, similar to being in the home of a passive smoker in terms of exposure, unless you've got an amazing range hood, which like the sort they use in industrial kitchens, and then it reduces it to about 2%. But otherwise, about 12%. So that's that campaign will be coming up, and another kind of advocacy co-benefit story. How are we doing for questions?
We've got one more question from the online audience. Do you have any other suggestions to talk about in care plans with our patients?
I think that's very individualized, isn't it, with all the care plans that we do. And again, it's that being open about what they may be concerned about, but also having a read and you having a think about what you're comfortable talking about, and reaching out to, say, the SIG group or someone that you might know more about, and just talk through what you might, I think it's an exploring space for all of us. The more that you do find out more you can put into the care plan with the patient themselves. I have personally found it, very individual based. And then also it really depends on the region. So I gather I've only been here 3 years, but I know that Geelong's had quite a lot of flooding in the past. So again, orientating flooding, I know that the RSCGP has actually developed guidelines with the flooding and its impacts for this as well. So I think also advocacy-wise, we will be continuing to work on this area to provide more education.
Thank you. Yeah, so we're going to wrap up. I just want to make sure no one got the wrong idea about solar panels and that 50K. Enhancing digital health capability, upgrading infection prevention and control arrangements, and maintaining or achieving accreditation. So, I guess, Bernard, do you have anything to add and about anything that your practice has been doing? Is this thing on? No?
Hello.
There we go.
Okay. First, it's not 50K, it's 25K for most of us, and only one practice in the West Vic region get 50K. The rest of us get 25K.
Okay.
So, but even with that, and there is a $5,000 interest-free loan that you can apply to the government, but you need to go through a lot of paperwork to get that done. And thanks to Frank and helping out, so we got that $5,000. Our solar panel is going up on Monday. So it's a pretty exciting time. And in terms of using the $25,000, I guess you need to have pretty clever framing to sell it as part of improvement for the patient's health. And if it is, if you can write it up and say that, yes, I need that, so the patient's care, we deliver better care, and I'm sure the government would accept that. So as part of the improvement of the IT equipments, we need better power to power all these equipments. So that's why we're putting solar on top, and together with the EV chargers and everything else as well. So it's really about the framing of it.
Thanks, Bernard. Okay, so leah.penny@westvicphn.com.au if you'd like some support in greening primary care, reach out. I think the next thing is that you might think, what about doing an audit? Geelong Sustainability might, be able to come to hand, and we'll be looking at other regions, or it might be about thinking about emerging a few champion practices that have tested and tried some of these things and can demonstrate, a clearer goat track towards a green primary care. So thanks. We're going to wrap up this session. I'd like to thank Dr. Forrester and Dr. Huang for visioning a positive future and giving us some really tangible things that we can do to step towards that. So thanks, everyone.